Welcome to this rapid-fire clinical drill explainer. We're jumping right into the clinical MCQs today, so let's get started immediately. All right, Block 1, Clinical MCQs 1 through 6. Let's dive into this first set. First question, transfusion of cold blood may result in which complication? Is it A, hypocalcemia, B, acute hemolytic transfusion reaction, C, febrile transfusion reaction, D, cardiac dysrhythmias due to hypothermia, or E, allergic transfusion reaction? If you guessed D, you're right. The correct answer is D. Here is the detailed reason. Massive transfusion of refrigerated blood causes hypothermia, and hypothermia actually impairs coagulation and strongly predisposes the patient to cardiac dysrhythmias. Make sure you lock in those exam pearls on the screen. Next up, if a patient requires multiple blood transfusions during surgery, ideally cross-matching should be performed after A, each bag, B, 2 bags, C, 3 bags, D, 4 bags, or E, 5 bags. The correct answer here is absolutely A. To detect newly formed antibodies and ensure total compatibility, blood banks ideally need to perform compatibility testing before every single transfusion episode. Moving on, what is the earliest manifestation of systemic inflammatory response syndrome, or SARS? A, documented infection, B, pulse greater than 90 per minute, C, pyrexia, D, increased WBC count, or E, tachypnea. The correct answer is B. So, the early release of TNF-alpha and IL-1 stimulates sympathetic activity. Because of this, tachycardia is actually the earliest detectable clinical sign of SARS. All right, which statement is correct regarding fibrinogen or fibrinolytic therapy? A, careful monitoring is necessary. B, a fibrinogen level of less than 100 milligrams per deciliter is associated with increased risk of bleeding. C, it should be given in hemorrhagic stroke. D, major surgery is not a contraindication, or E, recent CVA can be treated if CT brain is normal. The right answer is B. Fibrinogen is essential for clot formation. When those levels drop below 100 milligrams per deciliter, the risk of bleeding increases significantly. Next question. Which of the following are vitamin K-dependent clotting factors? A, 2, 7, 9, 10, B, 3, 7, 8, 11, C, 3, 7, 9, 11, D, 2, 7, 9, 13, or E, 2, 5, 7, 8. The correct answer is A. Vitamin K is required for the gamma carboxylation of clotting factors 2, 7, 9, and 10. This allows them to bind calcium and function properly in coagulation. Keep that classic 1972 mnemonic in mind. Which of the following clotting factors are deficient in banked blood? A, factor 2, B, factors 7, C, factors 5 and 7, D, factors 5 and 8, or E, factor 9. The answer is D. Stored banked blood shows progressive degradation of labile coagulation factors. This especially affects factor 5 and factor 8 because they are highly unstable in storage conditions. Okay, moving straight into Block 2, Clinical MCQs 7 through 11. Which of the following statements regarding whole blood transfusion is correct? A, it's the most common in the U.S. B, it's effective in the replacement of acute blood loss. C, large supplies are available. D, it's given in elective cases. Or E, it has higher rates of disease transmission. The correct answer is B. Whole blood is very useful in acute massive hemorrhage because it provides both volume expansion and oxygen carrying capacity. However, component therapy is preferred today, so whole blood is rarely used in developed systems. In patients receiving massive blood transfusion for acute blood loss, which of the following is correct? A, PRBCs and crystalloid to restore oxygen and volume. B, 2 units FFP with 5 units PCV. C, 6-pack platelets with 10 units PCV. D, 1 to 2 ampules sodium bicarb routinely. Or E, 1 ampule calcium chloride with 5 units PRBC. The correct answer is A. For the initial management of acute hemorrhage, you need crystalloids for volume plus packed RBCs for oxygen delivery. Massive transfusion protocols later use balanced 1-to-1-to-1 ratios. Next, which of the following solutions is most commonly used for the storage of blood? A, ACD, B, CPD, C, albumin, D, dextrin, or E, SAGM? The correct answer is E. SAG-M is the modern standard preservative solution. It prolongs shelf life to about 35 to 42 days by providing an energy substrate and stabilizing the membrane. Hepatic glycogenolysis is mediated by which hormones? A. Cortisol. B. Growth hormone. C. ADH. D. Glucagon and epinephrine. Or E. Epinephrine. And the correct answer is D. Both glucagon and epinephrine activate glycogen phosphorylase via the CAMP pathway. This directly leads to glycogen breakdown in the liver during stress and fasting states. Final question. Which of the following is not implicated in reactionary hemorrhage? A. Clot displacement. B. Slippage of ligature. C. Infection causing vessel erosion. D. Rising BP on recovery. Or E. Cessation of vasospasm. The correct answer here is C. Infection-causing vessel erosion is actually a cause of secondary hemorrhage, not reactionary hemorrhage. Reactionary happens under 24 hours. So as we wrap up this rapid-fire explainer, I want to leave you with one final provocative thought. Will you remember these exact timelines under exam pressure? Keep reviewing,